The healthcare system in Canada is treasured by Canadians, but also has a lot of challenges, a lot of problems because of its design, because of its cost, and you can never provide enough healthcare.
How can a set of skills lead you down the path to success? That's what we're setting out to answer on the EdUp Canada podcast. I'm your host, Michael Sangster. Join me as we unpack how leaders around the world have taken training and skills and turned that into a lasting career. Now let's learn together. Welcome back to the EdUp Canada podcast. I'm Michael Sangster, your host, and I am joined today for episode 65 by Terry Lake. I would give you his resume, but it is diverse and unique. And I think we're going to have some interesting conversations around skills development, training, education, but based on his lifestyle and where he's been and what he's done. So, Terry, do you want to just spend a minute and introduce yourself to the audience?
Well, thanks, Michael. I'm currently the CEO of the BC Care Providers Association, which is an industry association representing providers of long-term care, assisted living, retirement living, and home health. I came to this role largely through my work in politics. I was a local councillor in Kamloops, British Columbia, then became the mayor, went on to provincial politics, became the MLA for Kamloops North Thompson, and served as Minister of the Environment for 2 years and Minister of Health for 4 years, which is, where I certainly got a lot of background that I use today. But originally, I actually started my career as a disc jockey and a radio news reporter, and then went on to become a veterinarian and had a veterinary practice and ended up teaching animal health technology at Thompson Rivers University in Kamloops, which brought our family to Kamloops. So very diverse background. The journey has been somewhat meandering at times, if you like, but always interesting.
And you served in the cabinet of a good friend of mine, Christy Clark. I served on the National Executive of the Liberal Party of Canada with her in 1990.
Wow.
So it goes back. What a dynamic leader, huh?
Yes, Christy, she's just a lot of fun to be around, inspirational, of course, hard worker. And one thing that she really valued was people that were able to do their job, and she didn't have to worry about guiding, directing, managing people. If she had confidence in you, she let you do your job, which was always appreciated.
So your career path, I'm going to go out on a limb here, but managing the Department of Health in a province, is that the most complicated, most difficult, most nuanced career job you've had during your career?
Yeah, it's interesting. I still have dreams about doing veterinary surgery and dropping my instruments on the floor. So you'd think I'd have more dreams about managing the healthcare system in British Columbia. But certainly it is very complex. And to just give you one example, dealing with the toxic drug problem here in British Columbia, which, was the first province to be really hit hard by fentanyl and all of the challenges and desperation that caused. And, it was difficult to sleep at night thinking that, you were supposed to be someone that could actually make the situation better. And as hard as you tried, these problems can be intractable sometimes. And the healthcare system in Canada is treasured by Canadians, but also has a lot of challenges, a lot of problems because of its design, because of its cost, and you can never provide enough healthcare. So there's always issues that you have to manage.
I always say we have the greatest healthcare system in the world until you're in it. And then it's got its challenges, but you've still got it, and it's not going to bankrupt you while you're in it. So we get through it, but it's not easy, is it?
It's not easy. And I think, to be honest, Michael, to be completely frank, I think people use that as an excuse not to make it better. They say, in the States, number one cause of bankruptcy is healthcare costs. And while that may be true, that's not an excuse to fix the fundamental flaws in our system. And if you look at our system versus the other OECD countries, we are, apart from the US, we are the worst performer and spending much more per person. So there's some fundamental flaws with our system, but our Canadian ideology of never looking at alternatives that every other country has is getting in the way of us improving the system. So there you go. I'm a big, I ran for the federal Liberals. I am a Liberal. I believe in the public healthcare system, but I also believe in looking at ways of modernizing it, adding to it, finding ways of putting more money into it, even if that's people's own personal money, to make the system better. And there are ways and means of doing that. You just have to go to Australia, France, Japan, Germany, UK, all systems that work better than ours, where there's more alternatives available to people.
So you stepped into the next iteration of your career into running the BC Care Providers Association. And at the National Association of Career Colleges, interesting, our provincial association put your name forward, and we were honored to give you a King's Coronation Medal for your service to British Columbia. And that's where we finally got a chance to meet this year. But what your perspectives, because talk about careers, talk about job needs. Long-term care is a massive issue in Canada, and you'd have a great perspective on that.
Well, seniors care, living wellness and care writ large. And it was a great honor to receive that medal, by the way, Michael. Thank you to the association for that. It was a true honor. But yes, if you look at the dynamics, the demographics, the dynamics of what's coming at us, we had Dr. Kevin Milligan from UBC address our conference in Victoria just at the beginning of June, and he painted a very stark picture of what's coming at us. Someone like me, 68 years old, height of the baby boom, I'm in great health. I work at it, and I want to be healthy for the next 20 years of my life, which is, I think I've got 20 good quality years ahead of me. But for many people, they are not necessarily blessed with good health at that age. And we look in our 70s and 80s and 90s, that's when most of the healthcare is consumed. And it's expensive healthcare. And we've got a huge wave of baby boomers coming at our system, and we are absolutely not prepared for it. Whether it's acute care, assisted living, long-term care, home health, we don't really have a proper plan as a society. And we kind of have this idea that government's going to figure all this out. And guess what? They're not, because they don't think, unfortunately, in 10 and 20-year horizons. They think of 4-year election cycles. And there's always something that's more important that you have to deal with this week or this month. And so we really haven't been thoughtful in many ways about the aging population and the stress and strain it's going to put on society writ large, not just the healthcare system.
Well, I heard the numbers that I believe it's Dr. Milligan presented at that conference, and the growth curve heading into their 90s is scary when you look at the workforce we have. And I often quote the statistic of that we've gone from having 7 workers for every retiree to be on the verge of being 2 for every retiree.
Exactly.
Which makes me pivot. Before I do that, actually, I want to talk, though, was where we did that ceremony was really interesting. And you helped us with that. But that facility we're in is what we're all going to need, but it's not going to be there for all of us. But can you talk a little bit about that place? Because it was a really neat, it had every level of care, didn't it?
Yeah, Elam Village in Surrey is a faith-based organization, a not-for-profit provider of independent living. So you had people that are living in duplexes and then in apartments, and then they've got assisted living and then full long-term care. So you literally can move through that needs spectrum as you age. And, it's a very, very large community in Surrey. Took a lot of planning, a lot of forward thinking, and that is getting harder and harder to do with land constraints and the cost of land, of course. But that's the ideal situation where you've got somewhere where you and your spouse can age in place together. And as your needs change, you don't have to go kilometers and kilometers away from each other. You can age in place together. And that's the ideal, but it's expensive. It's very expensive. And healthcare, like we were talking earlier, people think, well, healthcare is free, but for seniors care, it's not covered by the Canada Health Act. So actually you can buy all the care you want, and people are spending a ton of money, $12,000, $14,000, $15,000 a month for private long-term care, assisted living, a little bit less for assisted living, but it's getting harder and harder. And governments in Ontario, for instance, they've got a very, very ambitious program to build long-term care homes, and I applaud them for that. They're using the private sector effectively. Here in British Columbia, unfortunately, the government likes to do everything government-owned and operated, and it's literally double the cost of building these units. And that means taxpayers' dollars aren't really being used as wisely as they could be.
Hi, EdUp Canada listeners. Before we get to the rest of today's episode, I want to introduce you to one of our sponsors, Placement Pass by Paramed. Managing student placement screenings can be a real headache for colleges. Medical clearance, background checks, document tracking, it's a lot to handle. That's why Placement Pass was created. Backed by Paramed's trusted healthcare team of over 10,000 professionals and 2,000 nurses, this platform makes the entire process smooth, secure, and simple for both students and staff. What really stands out is how it reduces the workload for faculty while keeping placement safe and compliant with privacy legislation. And best of all, it costs nothing for your school to use. If your institution wants an easier, risk-free way to manage student clearances and focus more on education, check out Placement Pass by Paramed. Placement Pass, making placements easier, safer, and hassle-free. I'm a lifelong Liberal, but I'm a bit of a Doug Ford fan because he's done some creative things. During COVID,
Yes.
he took some actions that I don't think he wanted to do, but he knew they were the right things to do. He buckled down and worked very well with Prime Minister Trudeau. And I'm watching the long-term care work they're doing, but also the wages around what we call PSWs, I think healthcare aides in British Columbia, I believe.
Yeah.
Talk to me about some of the workforce needs there, because last year we went on a bit of a campaign with the federal government around healthcare workers or skilled trades to try and make people think differently. And I'm interested about your perspective as on the workforce needs in British Columbia.
The government here, I will say, I may be critical on some things with our government here, but certainly give them high praise for addressing the workforce needs in seniors care. First of all, they brought in what's called wage leveling. So if you were a care aide making $18 an hour at a not-for-profit or a private care home, they basically bridged the gap between that and what we call the Health Employer Association BC master collective agreement rate of $25 an hour. So, all of a sudden your pay went from $18 to $25 an hour through the pandemic and beyond. They're now in the process of looking at whether they can keep that going or not, but they recognize that those frontline workers were so important and they deserve to be paid well. They deserve to make it a rewarding career, and they did that. And also they brought in what's called a health career access program, whereby anyone could train to be a care aide or PSW, as you call them in Ontario. And all of their training costs were looked after. And of course, there's a guaranteed job at the end of it because the needs are so great. So they've done a lot of work. And we also have training programs that we run with some of your partner colleges to train care aides and also to ladder them up to licensed practical nurses, which is something new that we're doing now.
We're trying to bring that to some other provinces. We're able to train nursing in British Columbia, New Brunswick, Alberta, but we'd like to see that in other provinces because there just are not enough places to train in the community colleges and the universities for these roles that we desperately need. So if you had an ask, and I'm sure you do, and I guess you've announced your retirement and your replacement, I hear, for the association that's coming. Will you be good at retirement or a failure at retirement?
Well, people are predicting I'll be really bad at it, but I just picked up a new puppy, a Nova Scotia duck tolling retriever. So I now have a redheaded puppy for my enjoyment, and he's going to keep me busy. But, I sit on a couple of boards. I sit on a board for a science center in Kamloops and a community health center. So there'll be lots and lots to do. And Mary Polak is the person that's taking over my position. And Mary worked with me in the provincial government. She's a former Minister of Environment, former Minister of Aboriginal Relations, and she's going to be fantastic. Her dad is in care in one of our.
Follow you as minister twice too?
Yeah, she did.
Is that what I saw? I thought I saw the name, and I was doing a little bit of digging, and she followed you at health and at environment, and now at this job.
She followed me in environment and briefly in health, but people say that she comes in to clean up my mess. So we'll see. Hopefully, I haven't left her a big mess here at the BC Cares Providers Association.
So leaving immigration out of it, if you had two asks, one of the province, one of the federal government, for long-term care in British Columbia, what would you ask?
Well, first of all, if it was provincially, I would say let's use our taxpayer dollars wisely to build the care homes we need. We can build twice as many for the same budget. That would be my ask provincially. Federally, it really is about getting into the help to finance the building of all kinds of homes, whether it's retirement homes or whether it's long-term care homes. Canadian Mortgage and Housing Corporation used to play a big role in this space and less over the last number of years. So I think we really need to re-engage CMHC these are people's homes. They're provided 24/7 care, but they're people's homes. So what part of Canada housing doesn't apply here? It really does. So I'd like to see CMHC get more involved there as well.
Well, we've got a federal government that sure is focused on finding ways to build homes, whatever level it is. So it'd be interesting to see how successful they are at that, but taking some bold steps. I'd be remiss if I didn't have at least a bit of a conversation about immigration, because it's such a crucial part of the students that have come into our institutions. Although we pointed out last year, we were about 4.5% of the international students. They're very targeted into these kinds of roles in healthcare, and we'd like to see that changed. I'm assuming you're of the same view, because BC was fairly proactive in this world.
Absolutely. The government here, we had 8,000 nominees to the provincial nominee program, which is part of the federal immigration system. And the government wanted to increase that to 11,000. And instead, the federal government cut it to 4,000. So this whiplash that we've seen on immigration is very short-sighted. I understand the pressures that it puts on housing, it puts on healthcare, but who the heck is going to perform these roles? Importantly, in seniors care, a huge portion of our frontline workforce are people that came from somewhere else, the Philippines, from Africa, and many, many other countries. And they have played a huge role in that workforce. And there's just not enough people that are here today as citizens that are willing to step up and do these jobs. So without immigration, I fear our health human resource challenges are going to get greater and greater and greater. And I told the immigration minister when he was here in Vancouver that it's absolutely short-sighted to do what we're doing without considering healthcare as a critical need that in large part can be filled through immigration.
And I know you're a fan of our sector, as the colleges and universities are, but that we're good at that kind of training. And I'm glad to hear you talk about laddering up and into nursing, because we need to do that. And interesting with those newcomers to Canada, they can't necessarily afford to do 4 years or 3 years too. Sometimes they need to do a year, go to work for a couple of years, then come back.
Well, a lot of times they have great experience overseas, but that doesn't translate into, certification here. So with a little bit of training through career colleges, they can get into the workforce, close the gaps, and work their way up within 3-4 years to the role that they used to fulfill back in their home countries. And so it's really a missed opportunity that we're not taking advantage of that.
I'm not as familiar as the BC world, but in Ontario and in other provinces, they've done a really good job of now creating new programs to push workers into rural. And I know BC, I do know a bit about the education piece. They've been flexible in the way they allow some of our colleges to operate in rural areas. Are you happy with the approach they've taken to promoting healthcare jobs into the rural communities?
Well, I would say it's a mixed bag, Michael, to be honest. It is, when we see emergency room closures in small communities, it's simply because of we don't have the people to fill the roles. You could say the same about laboratory services. Certainly is difficult with care as well, long-term care. You just don't have enough people. Now, Northern Health has done a really good job. They've created almost their own agency, moving personnel around the northern part of the province to fulfill these jobs on a sort of rotating or temporary basis. And they seem to be having some good success there. But I think we're going to need to replicate that. The whole issue of agency nursing has become a challenge because through the pandemic, a lot of frontline workers, care aides, practical nurses, registered nurses were hired away by these private agencies and then basically rented back out to the health authorities and care providers at double the cost. And so more money for the same amount of care has been proven to be very expensive for the system. So I know BC and other provinces are trying to manage this down a little bit, and I think it's starting to take effect. But that's because of the marketplace, right? If you had double the number of care aides, double the number of nurses, you wouldn't see this happen.
It was interesting. I had a couple of weeks ago, I had a friend of mine, Joel English, on from the AIM Institute of Aviation Maintenance. And he got talking about the average age. So airplane maintainers tend to be white males, 50, 52 years old. It's another sector, but it just shows this curve we're going to be dealing with in healthcare too, that they're dealing with the same problem and they're trying to recruit a new generation and train a new generation of people. So they're going into new communities to find new students to train them up on these great, well-paying $100,000 a year careers. So it's interesting to see another industry with the exact same issue. And you wouldn't talk about airplanes and healthcare a lot, but they're in the same boat.
Absolutely. And, healthcare, whether it's a care aide in a long-term care home or a nurse in an acute care hospital, this is, very labor intensive work. And I know there's a lot of worry right now about artificial intelligence replacing workforce. Well, they're not going to replace nurses. They're not going to replace care aides. They're not going to replace people who, that human touch is so important. And so maybe it'll free up people to come into this sector. I hope so, because you just can't replace care aide with artificial intelligence. You can optimize their time a little bit, but you need that touch. And so it does require someone to be in good health. And what we see is as people in this sector age, of course, they're running into musculoskeletal problems because you're lifting people and things a lot. So again, using technology to help with that physical part of the work is important. But yes, we have people aging out and not enough young people coming to backfill.
It's interesting. We're waiting on approval of a couple of AI programs, and one of them is around healthcare, and that is to free up some time and effort. But what's interesting is we get calls from dentists who are closing practices because they don't have enough dental office assistants, not dental hygienists, but people to run the practice for them.
Right.
And I got on the phone with one doctor who was working in Northern Ontario, and he was one dentist, and he was chatting about how he has 3 practices, 2 days, 1 day, 2 day. And then he rotates the dates and goes through, but he needs someone in each practice to keep it running. So when he gets there, everything's ready to go because he's only got a day, and he's having to close one of those offices because he can't find a worker in a different level. So there's so many layers to the healthcare system that we don't think about in this workforce. One of my favorite ones I like to talk about now is truck drivers. We have a massive shortage of truck drivers in Canada. And if the truck doesn't roll the equipment to the hospital or the clinic or the long-term care home, they've got a different issue too. So there's other pressures.
Everything's interconnected. Yeah. With the kind of society we have now, which is basically get everything delivered to you, those truck drivers are more important than ever. And again, without immigration, I'm not sure how we're going to meet the demand there. So it crosses so many different parts of the economy.
So you've clearly been very successful in life. I didn't realize this till today. You're born in England. So that's okay. It's not Scotland, but it's close.
Well, my mom's Scottish.
Okay, so we're good. We're good. You have my pigment too. So I can tell there was something there. I like to say I'm pigmentally challenged.
Yes.
I'm interested in, you've had a good career path, obviously, but what's a skill set that has made Terry successful? And is it something you had or something you developed?
Well, I think you are who you are. So I can't take credit, for the genes that came together when my English dad met my Scottish mom. So you are who you are. And since I was a kid, I've been pretty tenacious and hardworking and curious. So I like to learn and I like to try to accomplish things. But I'm not afraid to try something new. When a door opens, I tend to walk through it. And some people call that a short attention span. I just call it trying to find interesting things to do. So as it sort of described my career, it's been very varied because if someone says, hey, we'd like you to do some of this or think about that, I go, oh yeah, okay, why not? Let's give it a try, within reason, obviously. But I think it's a combination of curiosity and maybe insecurity in that you're always trying to prove that you can do something.
That's an interesting way of putting it. That's a pretty honest answer, saying that insecurity probably drives you.
Yeah, a little bit. It's like I have 3 daughters, and they're all wonderful in their own way. But my middle one is a bit like me, and she talks about having imposter syndrome. And I said, well, that's what makes you so high functioning, right? You've got a lot of anxiety because you're worried about doing things really, really well, and then you're worried you're not really doing it well enough, so you feel this imposter syndrome. So that's what drives people. That drives people to do really ambitious things.
I've got somebody in my life who called me rearview mirror. And he used to say I'd go into a room and I'd weave through 1,000 people. I'd know them all. I'd go out the far end confident. And I think I was actually hiding some things with confidence that maybe I didn't have those skills as you're talking about. But this person's point to me was you'd weave your way through the room. You'd know everybody. You'd come out the far end. If you'd ever look in the rearview mirror once in a while, you might see the accidents you caused. And talk about some of those things. So we like to ask the question because we encourage our learners to find something they're good at, drive with it, and find something you're bad at and work at it too, right? I was a procrastinator and I've learned to make lists and I've learned to check them off. And I got that from my father. There was always a list, and you work your way down the list. I'm still not as good as I'd like to be, but that's my weakness. So it's funny.
Yeah, I'm one of the questions you always ask is about a mentor. And, I was trying to think, okay, who do I look to kind of try to emulate? And it's probably my brother, Tony, who's a couple of years older than me. And Tony trained as a plumber, but really most of his career was spent in facilities management. And he, I don't know if the right word is managed people well. He worked with people really well. I listened to him talk to people on the phone or in person, and his interactions. And I learned a lot from him because I tend to want to get from A to B very quickly. And sometimes I can be short, or I'm thinking about one thing and reacting to something else while I'm thinking about the other thing. And I learned from him to be a little more centered on the conversation you're having, the person you're having it with, and just slowing down a little bit and not sort of translating your own stress to the other person that you're dealing with. So that to me is something that is something I had to learn to do because I'm just so driven to get to the next thing that I'm not thinking about. Sometimes I'm not thinking about the thing I'm dealing with right now.
Yeah, it's two questions in one. You're the first guest who's managed to do that. So I'll ask you the quick follow-up then. Do you think your brother knows that he was a mentor to you?
I think so. I've told him many times that I've learned a lot from him, and we're very close. We're best friends. And so, yeah, I think so.
That's nice.
Yeah, it is nice. And, as you go through life, you realize how more and more how important your family is to you. And so we're both blessed because our families have been always close and our kids are close with each other as well. So that's kind of cool.
So you strike me from our time together today and before as an optimistic person. Are you optimistic we can deal with this surge that's coming in long-term care?
Well, we have to. We have to. I mean, we don't have any choice. Governments sometimes put off dealing with these things. Society puts off dealing with these things. But at some point, you've got to have an all-hands-on-deck approach. And I think in our association really trying to create that awareness that this isn't any one part of our sector's problem to solve. It's all of us together. So, as an individual, you need to be thinking about your later life, how you're going to manage. You have to think about keeping yourself healthy so that you're not having to rely too much on the healthcare system. You have to think about how you're supporting others around you because it's very, very stressful dealing with care in the seniors care space. I see the stress on families all the time. So yes, I think we will figure it out. I mean, it won't be perfect, but you have to be optimistic. And I know sometimes, politically, particularly today, it's sometimes a little hard to be optimistic, but I'm a student of history and I know we've gone through ups and downs a lot. And we always, there are hard times and then times get better. So I think we still live in a world that's better today than it was yesterday and will continue to get better. We just need to pull together on this particular challenge.
I always quote what's become my favorite quote recently. I've mentioned it a few times from Tom Hanks on one of these actors series. And somebody asked him what he thought was the most important lesson he's learned in life. And he said, "This too shall pass." And he said, when your career is at the bottom, which I'm not sure he ever had a career bottom, Tom Hanks, but he said, "This too shall pass and your career will good. But remember when you're on top that this too shall also pass and you will go to the bottom." But I think it's a good message for things, and it's very apropos with our relationship with the United States right now. This too shall pass. They are our best friends, our best neighbors, and this too shall pass.
I'm trying to tell myself that now as I get up at midnight and 3 a.m. to get my puppy out to pee. This too shall pass.
This too shall pass.
House trained.
Don't look at the phone while you're all the way there because there might be a new tariff by the time you get to the door. So, Terry, thank you. I'm glad we were able to connect. We had I like to be transparent. We had a bit of a false start, you and I, when we got started, and we tried to do some work together, and I wasn't quite ready at our end. It was all coming at me from so far, so many places, and we managed to reconnect, and I was so excited to present that medal to you because if anybody just looks at a Wikipedia page or just checks out your career, you've given back to community, and you've made a difference. I was going to chat a little bit about your veterinarian time and your teaching time, but there were more important issues today than that. But thank you for joining us. And is there anything else that you want to add before we sign off?
Well, just this, the teaching, I had 8 years of teaching animal health technology, and I loved every minute of it. So for educators out there, there's no higher calling, I don't think. And it's just so much fun to see people develop and become confident and skillful. That's what we need. So thanks, Michael. I really appreciate it. Appreciate all of our partners here in British Columbia that we work with. There's some amazing people and organizations out there that are members of yours, and we hope to keep that relationship going.
Well, and you work with one of the best, Krista Clark. That
Absolutely.
is just, I want to see the day she's not smiling. I haven't seen it yet, but she's always lighting up a room, and she was so gracious about making sure that we connected to do this. But also, I'll be honest with you, nominating you and making sure you got that King's Coronation Medal. So that was a great ceremony.
Yeah,
and
thanks.
Of the ceremonies we did some neat ones because we did every province. But to do it in a long-term care facility like that in their chapel, which was beautiful, like any church, we proud of that chapel they had there. It was a really good experience. So Terry, we'll sign off there. I'll look you up when I'm out your way. Is Kamloops still home, or are you in Vancouver?
Kamloops is home, and the Red Collar Brewery is where you'll find me.
I will not be hesitant to come join you there.
And my dog Spike.
I am working on my health, but my gout still flares once in a while. That's the habit of owning a steak and seafood restaurant that I have trouble getting rid of my gout.
Goodness.
But I'm fighting through that. So I look forward to seeing you there. And with that, we'll sign off for this week's episode and look forward to you all joining us again next week on the EdUp Canada podcast. Thanks for listening. Thanks for listening to another episode of the EdUp Canada podcast. We release new episodes regularly, so make sure you hit that subscribe button so you know when they are officially out. If you love this episode, please leave a 4 or 5-star review wherever you listen to your podcasts so that others can also discover how a set of skills can lead to success. Thanks for learning with us.